brought in the data from, the wearable device.
What are some of like the real challenges like a health system faces with like device data?
Kaiser, for example, they now have the largest remote monitoring program in the country. They've had over 500,000 people enrolled in Validic programs since 2018 when we first launched our solution with them across 7 regions.
GenAI is like a huge topic, right? How do these type of like GenAI capabilities fit into this bigger picture of like connected care?
We've actually created generative AI summaries in the EHR clinical workflow for clinicians. And what this does, we call this Validic Sparks. Patient came in and they were tracking their glucose readings regularly, but their blood glucose readings were higher in the evenings between 7 and 9 p.m. than they were in the morning. But don't worry, it's no butter, no salt, like it's fat-free popcorn. Clinician says, I don't know if that's good for you. Why don't you try cutting out that popcorn and see what happens? Patient cut out the popcorn. Within 30 days, their A1C dropped by 0.5 point.
Drew, thanks so much for hopping on the podcast today. And for the audience listening, we have Drew Schiller, co-founder and CEO at Validic, joining us. Validic is a leading health IoT platform that integrates personal health data into the health system to enable better, more proactive care. Drew, thanks so much for making the time.
Really glad to be here. Thanks for having me.
Yeah. All right, let's jump right in. So, Drew, I know you launched Validic over a decade ago, and you have essentially helped pioneer health data, how health data from devices and apps gets connected, right? What was the original problem you set out to solve, and how has your focus evolved over time?
Yeah, absolutely. We actually created the concept of Validic to scratch our own itch, which is a lot of times how some of the best products and companies are created. We were actually building a health engagement solution that we were going to sell into large self-insured employers. And as part of that, we identified the opportunity to connect in all of the wearable personal health devices that people were using in their daily lives. This was 2012. So think about, Fitbit and Nike Fuel Band and MyFitnessPal and Jawbone. And, as we started to bring in the data from all those apps and devices, we realized it's a much, much harder problem than what we had realized. And as we started to take an early version of that solution out to the market, people were saying, hey, it's cool what you guys are doing with this health engagement piece, but there's a lot of people trying to crack health engagement and they have a lot more funding, and you guys are just 2 guys in a dream. But this personal health data connectivity, that's really unique. No one else is really doing that. Like, what if you just enabled that for everybody else? And we kind of heard that feedback enough, and we started to say, I wonder if that might be something interesting, because it certainly was a thorny problem for us. So we started to take that out to the market. I remember we had a beta launch in April of a very quiet email blast launch in April of 2013, and got a lot of really early traction. Closed our first deal within 60 days. We were like, oh, wow, I think this is really something. And so then we launched to the market in the summer of 2013, and just things took off like wildfire. So we really found a niche where there were a lot of people scratching their heads saying, we know that all these mobile health apps are going to be important. We don't really know exactly how to get the data. And then out pops Validic, one connection to a world of mobile health data. That was our initial slogan. And the rest is history.
Love that. So you guys are truly veterans of this space. You've been around, you're saying the beta launched in the summer of 2013. That's over 10 years ago now. And now it's, one can argue it's even more than just apps. You have devices, you have AI now, that's, powering often some of these app and device connections. So
it's, what I tell my team is that every single day, the data that we capture in our daily lives matters more than it did yesterday. It matters more to our health. We're able to get more context. It matters more to the healthcare system as clinicians understand what to do with that data and how to use it to help educate us and coach us toward health and longevity. And so absolutely, and especially to your point, once you start to look toward AI, there's a lot of new help now to understand what's happening with all of this data and help it make sense and contextualize it for us to improve our health.
Right, right, definitely. And I want to ask you about the work that you've done with health systems, right? Because you guys have worked with some, fast forward 10 years, you guys have worked with some major health systems. I saw like Mayo, Kaiser. What are some of like the real challenges like a health system faces with like device data? Their patients interact with a lot of that. And how do you guys have ability to make it usable inside of clinicians' workflows?
Yeah, absolutely. When we first launched to the market, I remember this. What we would hear, and this was, 2013, 2014, we would hear directly from physicians, and they would say things like, I already have too much data. I don't need more data. And that's really completely shifted a decade later to now where they're saying, I actually really want this data. I just need to know what's important, right? And so they still don't want to look at all of the data, but they do want to know when something is important to pay attention to and have that presented in a way that's really easy for them to understand. So we actually worked with Kaiser Permanente back starting in 2016, 2017 on this problem where we had identified that in order for clinicians to really leverage all of the data that we're capturing in our daily lives, they needed the data to be in the EHR clinical workflow so that they weren't launching into some separate system. They weren't swiveling. It just needed to be part of how they deliver everyday care. So we did a lot of work to create a solution that makes the personal health data a first-class capability of the EHR, where we're writing discrete values into flow sheets. We're surfacing clinical escalations into the in-basket. So, the Epic in-basket or in-basket pools, for example, we are visually integrated in the chart as part of the chart. So you can take your clinic notes inside the EHR the same way you normally would. You leverage all kinds of first-class capabilities. We are really, really tightly integrated, even into the billing system, where because we're writing all those discrete values, you can leverage all of the revenue capture, billing capture capabilities that you would normally do as part of your traditional EHR workflow. So it's something we put a lot of work into. And as a platform first company, we always think, how can we help our clients get the most out of their existing solution with personal health data? So we have really leaned into that mentality with EHRs and have created, like an Epic integrated solution, for example, that is just native for how clinicians are leveraging the data. So with Kaiser, for example, they now have the largest remote monitoring program in the country. They've had over 500,000 people enrolled in Validic programs since 2018 when we first launched our solution with them across 7 regions. And this is everything from chronic condition management like diabetes and hypertension to moving up the risk chain to high risk pregnancy and chronic kidney disease, heart failure programs, as well as acute transitions of care and hospital at home type of programs where you're looking to discharge patients early from the ICU and still monitor them while they're in the home. And all the data comes back into the clinical workflow, and the clinicians are able to get notified if something is concerning. So they don't have to look at every data point. They really can just know that, hey, as long as I don't get pinged, everything is going okay. And we've seen some like really strong clinical results, as well as operational results. Like some of the operational results are pretty amazing. One example of that is inside of a cardiac clinic for heart failure. The nurses in that program went from being able to evaluate 6 patients an hour to evaluating 20 patients an hour with improved clinical results, where GDMT improved, ejection fractions improved, the readmissions decreased, and also they were able to get done in 2 hours. We used to take them a whole day. So it was just really, really incredible results because the data is built into the EHR clinical workflow. And they're able to get that accurate, timely information in the right place.
Right. Yeah. I mean, first off, those are very impressive results, just both from your work with Kaiser, but also this cardiac clinic. You said nurses could go from evaluating 20 patients an hour to 6, even with improved clinical results. So both of those, case studies speak volumes. And I want to go back to something you said that I think is extremely important, and it needs to be in the EHR clinical workflow, right? I think that's probably the number one fear that large providers have is like, no, like I don't want to add another system. My EHR is already complex. Some of our physicians aren't even fully trained on it, you know? So is what you guys built, you mentioned something about Epic Native. So is this like EHR agnostic these days? Have you guys really built a platform that can kind of flex and bend to whatever EHR that health system or provider uses?
Yeah, absolutely. Yeah. So it is built into Epic. It's in the Epic showroom. It's a downloadable application. There's actually an Epic written implementation guide for how to build
Nice.
Validic into your Epic instance. But also, we're similarly built into the Oracle Cerner workflow. And Oracle Health is actually a resale partner of ours for those for their clients. And we have a native-like solution there. They've actually also built Validic into their registries product in addition to their EHR. So it's a really slick solution where you can go all the way from population health management down to the individual care. And we have implemented our solution in all kinds of places. We've implemented a custom care management applications for a health plan. We're actually doing an implementation right now with a client into Salesforce Health Cloud, which we're excited about. So it's certainly, again, we are a platform company. I always like to say that, we started with integrations, bringing in all the personal health data, and like
Right.
that is a core capability of ours. So, the questions that people always ask is like, how do you get the data out? Which is really, really easy for us. And two is like, how well do you interface with others? And that's also like, that is a very straightforward, like that's how we built our system. And the number one question that I always really struggle to help people understand, because it's sadly kind of unbelievable how deeply integrated we can be into a EHR system, is, I just tell people, I say, listen, every single thing that we do is in the clinical workflow. And they're like, okay, cool. So which part of this is your application and how do we launch into it? And I'm like, no. It's in the EHR clinical workflow. There's no separate Validic application. There's a window in the patient chart if you would like that view, but you don't even have to use that view because we're writing all the values into flow sheets. You can build all of the print groups and reports, and you can forward in basket messages the same way you would any other thing. Like it is truly, you can leverage short codes and dot phrases. Every single capability you can normally do with other data types, you can do with the data that comes from Validic.
Yeah, very impressive. I mean, it speaks to like the work you guys have done over the last decade, like knowing the major systems to interface with. I mean, you just named three of probably some of the biggest ones in the healthcare space, but also knowing how to make those connections. Right? It's a platform business, like you said, and you guys it sounds like you guys have really built that intentionally. Now, you sort of alluded to this, but I want to drill into this piece about supporting like chronic programs, like chronic condition management, like TCM, like other remote programs. I think like those programs itself, providers, I think struggle to not just stand up, but then scale. And then it's like, man, I got this running. How do I integrate my existing system or another device or devices that my patients use? How are your customers using Validic to make that easier?
Absolutely. Yeah. So they're really looking to Validic as a platform that can be deployed across the enterprise to support different types of interventions across a variety of use cases. So, an example of where we kind of get sideways a little bit in some early customer conversations is when we get reached out to and they say, hey, we're looking for a program that is just for heart failure or just for diabetes, right? And
Right.
that's great. We can definitely service that use case. But as part of that, we say, so listen, here's how we deploy and it's in your workflow. But the nice thing is it goes beyond just the cardiology department. It goes beyond just the endocrinology department. It goes really into, across the whole enterprise. And, for those narrow deployments, we often get the project manager who says, oh, that's really cool. This is my remit, right? And so where we really find success with clients is when there's an enterprise strategy for how do we deliver remote care, period, right? Like we need an enterprise solution. We need something that's not a point solution for this, a point solution for that. right? We want to have something that can really support the whole spectrum. And one thing that we actually did to really fully enable this capability was about 2.5 years ago, Validic, pure technology company, acquired a logistics and tech support company. And we did that because 100% of our clients, as we were deploying this, need the ability to get devices into people's hands. They need devices, custom kitted, the same like you can't have the same device setup that supports a high risk heart failure patient that also supports a low risk hypertension patient, right? Like these are very different needs. And we really struggled to find a logistics partner that could actually flex from both the, just a responsiveness, from a price point, from a capabilities perspective, to really meet the needs of all of our clients. And so we went out and acquired one. It's been wildly successful for us. Our clients love the service. We have a 5 nines shipping SLA. We actually just set a new shipping record in September of all-time shipping. I mean, we're shipping, about 600,000 trailing 12 months shipments. I mean, just really, really strong numbers within that program. But all that is to say, we are a full enterprise enablement platform for everything from, high risk acute transitions of care, where you have someone monitored for just a couple of weeks post discharge from, COPD or pneumonia or UTI, et cetera, all the way through to, a pregnant person who has high risk diabetes, gestational diabetes or preeclampsia, someone with chronic kidney disease where you're looking to reduce crash starts, like the whole spectrum. And that's really what's unique about Validic and what our clients leverage us for.
Yeah. I mean, essentially what I'm hearing is like, it comes down to any department or service line that touches the EHR clinical workflow. Like this is something that can benefit them, but really for you guys, and you've evolved to be more of this like enterprise level partner, that, okay, hey, I want to stand up a remote care program for multiple departments, multiple patient populations, because it'll be different based on the market that they're serving, right? What they're tackling. But yeah, and congrats on the shipping record. I mean, that's huge, right? It speaks to your understanding of the customers. And I think that's always important when you see like, okay, actually our customers actually need help like acquiring these devices and like getting them, and then the hands-on support required for their patients to set it up. It's one thing to create the enterprise strategy, but if you don't have the process in place to get these devices and collect the data, it's like, it's for nothing, So
that's right.
Yeah. And ultimately, I think that's how a lot of these providers end up getting reimbursed too, right? Like you need to have certain measurements and data reads in order for them to get reimbursed from government programs, So
reimbursement, quality score improvement, reduction of readmissions, getting people out of the beds to improve capacity for higher DRG patients. Like, I mean, there's a lot of use cases for the data when you really get down to it. And, one that I'll add in there, which, people don't think about as much, is just loyalty from patients in a system. Leakage is a big challenge. And if you can have a place where people are putting their data and they feel like, oh, I am a part of this system, like my daily data is there. So when I go to my doctor, it's already going to be there. So now they're going there for, their primary care, their specialty and everything. And so one of the things that we've actually done is we've also brought in the data from, the wearable devices into the EHR clinical workflow, which is a really unique thing. So it's blood pressure monitors, it's thermometers, right? But it's also CGMs. It's, your Apple Watch data, your Fitbit, your Oura Ring. We can bring all of that data in as well. Not for everybody, right? These are for, context specific programs where they make sense, just to be really clear. But the point more being that it is really, there's not a technical hurdle to bringing the data in now. Now it's up to the imagination of how does the system and how do the departments want to engage patients in new ways in order to deliver the best care possible.
Right. Yeah, I love that. I mean, I think it's a fascinating understanding that, exactly what you said, like patients feel like they're a part of it, like they own it. I think, my professor from university is listening, Zeke Manuel, he had this prediction and I agree with it. I think over time, like health system, you will become a member of your local health system, and like you guys may be at the leading edge of that in the sense of like enabling patients to feel like, okay, I'm syncing up my data with my provider, but it's part of this health system, like I'm not giving my data to multiple like different parties, like this device company and that device company. It's like, no, like this is in the hands of my provider. So the patients win in this too, which is big and important,
Absolutely.
And next I want to slightly pivot gears to talk a little bit more about the tech. Like, look what's under the hood for a sec. Gen AI is like a huge topic, right? From what I understand, you guys recently actually launched like some sort of Gen AI service to surface insights from device data. Can you talk to us a little bit about what that looks like, and how do these type of like Gen AI capabilities fit into this bigger picture of like connected care? Because it's a hot word, but what does it mean in practice?
Yeah, absolutely. So, look, none of the data that we're capturing in our daily lives really ultimately matters unless we have context for what to do. And I don't think most people are sitting there outside of maybe casually looking and being like, oh, I slept kind of funny last night. Oh yeah, look, I looked in my app and turns out I slept not great last night. You know what I mean? Like that's not that helpful, right? What is helpful though is when you encounter a healthcare provider and they have access to your data and they're able to say, oh, we have an insight for you here that could be really helpful. And so what we've done is two things with Gen AI. So the first is we've actually created generative AI summaries in the EHR clinical workflow for clinicians. And what this does, we call this Validic Sparks. And what this does is it just really quickly summarizes for clinicians in a very fast way how well is the patient participating in the program, how well have they been adhering, or have there been any clinical notifications of concern? Just really quick heads up displays so that in 5 seconds or less, they really understand what's happening. And it kind of turns, the personal health data from like, okay, what's going on here to like instantly like, oh, I just learned something very quick about this patient that I might not have otherwise seen, right? And it's not because the data is not there. It's just because it would have taken mental compute and time. And those are two things that clinicians unfortunately don't always have a lot of. So we're just really quickly summarizing the data, and they can look at more so that the generative AI, quick headlines can be expanded to like really look into more about the data. And then all of the data is available further down on the screen so they can really get, drill down if they'd like to. And also in there, we can also generate a clinical progress note for the clinician because we have the context of not only what data a person is capturing for the program, but also what were their clinical goals. How well have they been adhering to the program? Have there been any escalations to the care team about this program? So we have all of that context. So we can draft a clinical progress note that then a clinician can click into and edit right there in the chart, and then save that as a note to the chart, which can be used for the purpose of compliance or billing or whatever the case may be. We can customize how that note is formatted based on the client's needs. So that's a really key thing. The other thing that we did was we actually built all of these really cool, very technical back-end capabilities in order to enable this, because what we don't want to do is provide clinical guidance, right? We don't want to provide diagnosis. We don't want, like, there are certain things we want to leave to the clinician, and that generative AI doesn't really have the licensure for. So we steer clear of those things. So we have really strict requirements around our prompts, our data prompts, how we prompt chain those prompts together to get the right output. Also, and then we also have a validation pipeline to ensure on the other side, when the data is coming out, that it's accurate and it's something that we know that the clinician is going to find value in. So we actually decided, well, hey, we built all of this back-end capability for ourselves. We have clients on the consumer side or on the health plan side that are outside of health systems that have a lot more context of the data than we have, right? And so, for example, a retail grocery chain, for example, in their pharmacy, which we have clients that fit this mold, like, they use our wearable data and our other health data in their pharmacy because they have patients who go there around for member engagement. They have, they're picking up their metformin for diabetes, or they're picking up their blood pressure meds, et cetera. So they want to keep their members engaged in the shopper app. And so think about, they have the shopping history, they have the medication history, they have all of it, and they have the context of the person's health goals. We have the context of how well the person is, taking their readings. So they can then basically, we can work with them to create a really hyper personalized prompt for members in this program that would say, hey, this person has slowed down on, maybe they haven't picked up their medication as regularly in the last couple of months. Can you send an engaging prompt for them that would help them understand why this is important? And so we can take, all of the history that and context that our client has, plus all the data that we have, send that through with the prompt request, and then come back with a hyper personalized, engaging message about why this would matter to that patient or to that member. So we really have created something that I think is a really, really unique generative AI platform for personal health data that has a lot of applications we're excited by.
That's fascinating. So what, for the, not as technical folks listening, or even some clinicians, what makes it generative? Like you described two scenarios, one on the actual clinical workflow with prompting like a little summary, right? And being able to provide a clinical progress note, like that generates that information without you asking when you're with the patient. And on the other hand, you're describing something interesting, which is like, patients often touch different parts, like they're consumers too. And they don't just go to their physician, they go to the pharmacy, they go to maybe even retail, their grocery. And like, those are all areas where you can pick up on data, right? And your platform and the connections that it has can pick up and then make further Gen AI like generative conclusions to assist whoever that patient is interacting with, whether it's the pharmacist, their clinician, right, et cetera. So
yeah, that's exactly right. And for clinicians with that EHR integrated summaries, what's great is think about pre-visit prep, right? Like you're already looking at the chart. Normally, all you have are the context of like the blood pressure reading and the weight that maybe the nurse
vitals,
took,
yeah,
right, yeah, right. Yeah. And you may have an A1C lab test or something like that, but you're kind of walking in, with very little information and otherwise just kind of history, right? And so one of the things that's important for us is like we want to turn clinicians from historians into heroes. Like, so we want to give you the context of knowing, oh, hey, so now I have all of this history, but I also see that the person has been, maybe they've been doing pretty well. The real life example, this actually is a real person. Patient came in and they were tracking their glucose readings regularly, but their blood glucose readings were higher in the evenings between 7 and 9 p.m. than they were in the mornings. So that prompted a clinical discussion to say, hey, rather than just like, hey, it looks like your A1C is still high, like let's try to adjust your medication. It was actually, hey, help me understand what's going on between 7 and 9 p.m. Oh, nothing. I'm eating healthy. I'm doing great. Well, are you having a snack? Like oh yeah, I'm having popcorn. But don't worry, it's no butter, no salt. Like it's fat-free popcorn. Clinician says, I don't know if that's good for you. Why don't you try cutting out that popcorn and see what happens? Patient cut out the popcorn. Within 30 days, their A1C dropped by 0.5 point. Their glucose levels normalized. And it was like an overnight change. And it was because of that unique insight of, hey, the glucose levels are higher here than before. And if you had only had the history, you wouldn't understand, what was actually happening on the daily basis in order to have that intervention.
Yeah. Can't trust those fat-free labels, No, but all jokes aside, like, I mean, it's a real life example, and I'm sure there's a lot of those, but it begs the question, like, knowing you guys you like to tackle like enterprise strategies for this, does this require the patients to be opted into some type of remote program, or can you guys help these clinicians also collect data from their devices for patients that aren't enrolled in a program? Like, is enrollment like a key requirement here still, that's the first question, and if it is, how far are we from like not having to have enrollment as a requirement,
Yeah,
like
sure.
ahead.
Well, so first of all, let me just say, we only ever deliver patient permission data. So some sort
Mm,
of allowance is required.
you need a
Like I have millions of people's wearable data, but unless you've expressly allowed me to, I don't have yours, right? And so, so
right.
that is, so there is a requirement of an opt-in, just to be really clear.
Yep. Yep.
Now, does that have to be a clinical program? The answer is no. So we have the concept of what we call a digital logbook, which is basically the idea is, for decades, kind of the standard of care for someone with diabetes or hypertension has been literally here, take this paper logbook, and every time you take a reading, write it down, and then bring that paper logbook in the next time you see us. And, the clinician would kind of flip through it.
Yeah.
And,
Yeah.
and I actually, it's funny because I've talked with clinicians before who've done this with patients, and they'll step into the waiting room and they'll see the patient filling out their logbook in the waiting room, like because they're like, oh, I didn't do my homework. I need to, it's like I got to do the homework on the bus, right? And so, what we can do though uniquely is that we can bring the data in as part of just a logbook, and what that means is we're not alerting, like we're not sending clinical notifications, we're not bothering the clinicians at all. But when the patient shows up for a visit, the data is right there and visible and viewable. And, it's been written where it needs to go into the EHR, and it's displayed and it's quickly summarized for the clinician to get a quick view. And so, yeah, it's not a clinical program, but it is absolutely has clinical utility and improves the patient conversation and makes it a more personalized care.
Right. Yeah. I think it comes down to like, can they make sense of the patient data, right? Like that's ultimately like, is it valuable data to them, right? Because if you're a clinician in a specialized field, like you really need the data points to help you make your diagnosis with whatever that patient is, whatever they're presenting as, whatever their chief complaint is, or if they're a regular visit, right? So it makes sense for larger health systems to really gear these around the types of like remote programs that their different departments have, but like really can their clinicians use the data and make sense out of it, because I think we're living in a very fascinating time where like even Apple and their, Apple Health, and now that it can connect to your EHR, but it's like, how much of that data are clinicians going to end up using, right? Like you got to make it valuable to them too, right?
That's right.
And that's where Validic, I imagine, comes into the picture when they're trying to make that happen. Yeah,
that's right. I mean, that is our mission. Our mission is to make personal health data actionable, and that is what we think about all the time: is how do we turn this into something that clinicians are thankful for, and that patients improve or have their health improved because of. And you're right. Like if feels like one more thing to do, that's dead on arrival. Every single thing that we do, we want to make clinicians feel like, oh, thank goodness I had access to this because it improved the quality of care. It made my job more efficient. I'm a better clinician because of it. So I think I think that's really the future. Like people live in the here and now with all kinds of data all over the place. Like going to a healthcare system where the provider doesn't have access to their daily data is like, how do you not have, like every other company in the world has access to every other thing that I do. Like Amazon knows what I'm going to buy before I buy it. Like you don't know what's going on in my daily life.
Yeah. Well said. I mean, and it's got to be permission, like you said. I think that's got to be highlighted, right? Like that's the unique nuance of healthcare data compared to other industries. As you guys even look at like patients as consumers, like it's got to be permission based. Like that's what makes healthcare data so unique. Is like you got to have the permission and the opt-in, otherwise none of this can happen. So very, very interesting. And just for others listening, like health system leaders, digital health leaders, that potential partners in the consumer space, like I know you mentioned pharmacy, that are listening to this conversation and interested in working with Validic or exploring what your platform does, what's the best way to start a conversation with you and your team?
Yeah, absolutely. So, you can always find us at our website, validic.com. I love connecting with people on LinkedIn. Just my name is Drew Schiller. Find me on LinkedIn. And then also you send us an email if you'd like to know more. Just hello@validic.com. We're always happy to chat.
Easy. We'll make sure to link that in the comments, and this podcast will go on LinkedIn. So we'll make sure to spread the word on all the great work you guys are doing. And Drew, it's been a pleasure speaking to you today. And I'm very impressed by the work you guys are doing. And I think this is a space that's ripe for more innovation as like access to data keeps expanding and our ability to use AI with it also expands. So I appreciate you making some time, and great chatting with you today. Thanks for hopping on the Health Tech Care podcast.
Yeah, likewise. Thanks, Bert. Appreciate you having me.
Thanks, Drew.